now we're going to do 3 manual muscle tests, one for the tibialis anterior, which would involve placing the patient into dorsiflexion and supination. And I'm going to apply plantar flexion and eversion against them, and they are going to have to push in on me. So keep your foot in this position as much as I try and push you out of it, okay? Ready, and go. Excellent, that's the manual muscle test for tibialis anterior. Eversion and pronation would be testing the perineals. So I'm going to put them in pronation or eversion. I am going to press along the outside lateral aspect of the foot, and they are going to keep pressing their foot out into eversion. Ready? And go. Excellent. And then to test the tibialis posterior, I'm going to place them into plantar flexion and have them stay plantar flexed as much as possible. Ready? And go. Great. Now I'm going to do some joint stability tests and look at stress testing for the talar tilt, which is inversion and eversion stress test. I'm going to take the calcaneus in my hand and put the toes along my arm and stabilize the leg above the ankle. I'm going to invert and evert the talus. Inversion, eversion. Now we're going to look at some of the special tests for the ankle. The first is the anterior drawer test, which helps with an ankle sprain, to identify an ankle sprain. So I'm going to cup the calcaneus in one hand, stabilize the upper leg above the ankle with the other, and perform lateral forward motion of the ankle. Next, we're going to look at the Thompson test. If you could flip over for me, that would be great. And this is just going to test if the Achilles tendon is still intact. Scoot down a little bit for me, towards me, thank you. I'm just going to squeeze and squeeze, and yes, you can see there's a reflex there. So the Achilles tendon is in fact where it should be. I can also do a squeeze test for an ankle syndesmosis or instability, and that's just squeezing the fibula and the tibia together, seeing if there's any pain. And then I'm going to have the patient turn back over supine and sit at the end of the table with their legs hanging over. And this is Kleiger's or external rotation test. All the way over for me, thank you. And I'm going to put the calcaneus in the palm of my hand, toes on my forearm, and I'm going to externally rotate the ankle. And that's Kleiger's test.